Hi, ladies and gentlemen, if there's any guys out there. We are the CHRISTUS Midwives, and we're just going to provide a few little childbirth classes for you during the month of October. Every Tuesday, you can watch live from 4:30 to 5:30, but then the links will be available so you can watch them at a later time. Share with your friends and tell them that it's free, and it's a really good way to get to know some things about what's going on during pregnancy, labor, and also some things about our hospital. During the course of these classes, you're going to see that we're going to be looking down because we're going to be looking at our notes, but we also have this book. You can find this book. This is a copy of the student book, and we're going to kind of use that as an outline of what we're going to be teaching. So you're welcome to find that. Prepared Childbirth the Family Way by Debbie Amos. Anyway, I'm Selena.
And I'm Dion.
Wait. I'm going to have you do that over in just a second, okay? If people...
Hi, we're the CHRISTUS Midwives. I'm Selena.
And I'm Dion.
And today we just want to share a little bit of childbirth education with you. We're going to be doing this every Tuesday in October from 4:30 to 5:30 live. The links will be available so that you can actually watch them later or share with your friends so that they can watch them at a later time too. I have this little book. I'm going to show you a picture of it, Prepared Childbirth the Family Way. You can actually go and find that and purchase that. It's not very much. You can get it by mail. We're going to be using this as kind of a springboard for the education that we're going to be providing this month. So there's some important business. Number one, stay muted so that background noise doesn't interfere with everybody's ability to hear what's going on. And the other thing is if you have questions, you're welcome to answer those. We have someone who's going to be watching those, so you can type those in. And at the end of the class, we'll see if you have any questions. We can possibly talk back and forth, but we won't spend a whole lot of time doing that. This time, we've been super busy delivering babies and doing the things that we do as midwives, and we didn't have a PowerPoint for you, but next week when we get into talking about labor, we will have some visual stuff for you to see. So the very first thing in the book, and the very first thing that's the most important during the course of pregnancy is communication. When you find out that you're pregnant, it's really important for you to communicate what you need and what you want with not only your providers, but also with your spouse and with your family so that they can help you. I know that sounds crazy, but none of us are mind readers. And you've already figured out probably that your husband is not a mind reader. And so you got to tell them what you want. You need to do a little bit of research so that you can articulate that well. When you get to the hospital, you don't have to spend a lot of time doing a birth plan anymore. My whole philosophy of birth plans is the best birth plan is no birth plan. It puts you in a place to where you are able to not get so locked in and zoned in on having to do things a certain way that you're really rigid in labor and you won't try other things. Most of the things that people ask for with a birth plan are actually the things that we are doing at the hospital already. So the whole gist of doing these classes is to try to help you to take care of yourself and to make some decisions about future things in your pregnancy. So communication is really important. Every time you go in for a prenatal visit, you really should have some questions. Remember that your provider only has a certain amount of time that she can spend with you, so 100 questions isn't going to work. But the top 3 questions is what I always ask for. Have those questions, write them down so you don't forget them, so that we can communicate and figure out how we can stay on the same page to provide care for you that is what you want it to be. So we're going to move right on along from there and talk about what a prenatal visit is. A prenatal visit is a visit that is designed for us to look at different components of what's going on with your body and your baby so that we can make sure that you're safe. So the components of a prenatal visit are blood pressure. We check your blood pressure because you may feel just fine, but we may figure out that your blood pressure is really high and we need to do something about that or do some further evaluation at least, which would involve blood work, watching you more closely, things like that. We also check your urine every single time. You're going to be leaving a urine sample because we want to know what's going on. It tells us things like, do you have protein in your urine? Do you have ketones in your urine, which lets us know that you haven't had enough to eat, especially in the last 24 hours? Are you dehydrated? Have you not been drinking enough water? And do you have an infection? So that urine sample is very, very important. A lot of different things can be identified with that. Another aspect of your prenatal visit is weight. We don't harp on how much weight you gain unless it's just a huge, big amount or not at all. My whole thing with weight gain is I'm going to look at you and see what you look like overall. Do you look healthy? Does your baby feel like your baby's the right size? Things like that. So we don't focus on numbers. We focus on what your overall picture looks like. Another part of prenatal care is Leopold's maneuvers. That's where we actually palpate your abdomen, so it tells us where your baby is, about how big your baby is. Is your baby head down? Is your baby posterior? It tells us a lot of things about what your baby's doing in there, and sometimes it can explain why you're having things like back pain or lots of pressure, things like that. It also helps us identify where to listen to the heart tones. So heart tones are important. Every single time we want to make sure that we find that baby's heartbeat, and the baby's heartbeat is somewhere between 110, 160, 170 if the baby's real active. I'm not one that encourages you to be taking your blood pressure at home a whole lot. If we need you to do that, we'll tell you that and we'll help you with that. And I'm not one to encourage you to buy a little handheld Doppler and constantly listen to your baby's heartbeat, because it's ultrasound. And there's not a lot of absolutely proven reasons not to expose yourself to ultrasound. But you have to remember that ultrasound is sort of like having a dog whistle. The dog can hear it, you can't. Your baby can hear those sound waves, and also the sound waves from the ultrasound actually change the temperature of the water around the baby. And it also puts a little motion in the water, and that's why babies start running from it as soon as you put it on there. So those are the most important aspects. And then talking and questions. Those are the most important aspects of your prenatal visits, aside from also doing lab work when it needs to be done, and any other specialized things if you have problems that we identify that need something. So those are all really important. So you need to go to all your prenatal visits. That shows us also that you care about your baby and that you are part of a team, because it takes a team for you to have a good outcome. So the next thing we're going to talk about is some comfort things. Why are certain things going on in pregnancy? You want to cover
Sure. So a lot of people will feel nausea in the first trimester. There'll be some what we call unicorns who will feel it the entire pregnancy. There's a lot of different things that can drive nausea, but mainly in the beginning of pregnancy, it's due to hormones. There's a lot of things that you can try on your own to try to improve the nausea. Eating small, frequent meals, making sure that you're not eating tons of fried items, eating crackers when you just wake up from bed, and or ginger ale during the day. There are different products on the market, Preggy Drops, Preggy Pops, those sort of things are all great and ginger based, so they're healthy and fun for the baby. There's also sometimes a component of heartburn or reflux that drives nausea. So some people will benefit from a Pepcid daily to see if that will sort of neutralize that. But there's a lot of truth in not eating and laying straight back so that everything flushes back. And then also sometimes it's hard to even just have single water. You might need to mix something with your water, like a little bit of Gatorade, or even try popsicles. But it's very common. It doesn't mean that anything is wrong. The baby will get what the baby needs. That being said, if you were to have urine that becomes very, very dark in nature, or you're unable to hold anything down, then we need to know. We cannot see you from the office, and we cannot see you in an email that you send through your chart. We need to know. Oftentimes, it's okay. We may send you to the hospital for fluids, and sometimes you just need the fluids to get you through it. I can speak personally. You can ask her, I was like on my deathbed with nausea for especially the first pregnancy. And what I learned with consecutive pregnancies is that burn or that feeling of nausea is actually the first feeling telling you to eat. And if you eat and get ahead of it, then it will actually go at bay. But if you wait too long and you don't feed that little burn or that feeling that you get, then you became, it's too far gone. So if we send you to the hospital, it's nothing bad. It's just something that's needed. It's also very common to feel very fatigued, especially in the first trimester and then in the last trimester. Most people during the second get that little energy boost, and that's completely normal. I mean, remember, especially in the beginning, you're like making whole organs and stuff. I mean, it's a really big deal. Your body's working hard. And if you already have kiddos at home, then you're going to feel it twice as hard because you're not going to be able to slow down to actually rest. So that's a very normal thing. You can also feel like your nose is constantly congested. That's due to the rise in hormones. There's a few things that you can do for that. You can use warm compresses on the nose, or you can do plain saline drops to try to relieve it. But some people will have that sensation through the whole pregnancy, and it's actually normal. It's nothing to worry about. Another huge issue is back pain, and some people, especially if you've had pregnancies prior, you might develop your back pain much earlier. But first-time moms tend to come in and say, like, my back is really hurting and I don't understand why. Your center of gravity is changing, and the baby is taking up space, moving organs around. You're going to want to try to maintain good posture, even though it's super hard to do that. You may consider some pelvic support items, such as belly bands or girdles. And we have a great place that we partner with here in Longview called the Women's Health Boutique. All you have to do is show up. They will help fit you, and they will show you which ones are best, and then they'll send us an order over to sign for those. And they're absolutely great. Other things you can do: Tylenol if you think you need it, warm pack on your back, not on the front, on the back. And then to make sure that you're giving support when you're sleeping on your sides by maybe putting a pillow between your abdomen and the bed so that you're helping those muscles to push everything forward. And then obviously good supportive shoes. I mean, high heels and a big baby bump don't really go together. We see it sometimes, but you're just sort of aiding your back pain along. And so good shoes, and then clothes that actually support. If you're wearing a little thong and a sundress with no support, of course your back's going to hurt. So just consider all of those things. The next one.
The other thing that we have a lot of questions about is shortness of breath. There's a few different reasons for shortness of breath while you're pregnant. Number one, as your baby grows, your uterus is standing up and it's pushing up. It's pushing all the organs around. It's pushing the intestines around. It's pushing up on the diaphragm, which also puts pressure on your lungs, which also puts pressure on your heart. So when your baby is to the point to where all this pressure is happening in different places, you're going to feel shortness of breath. Typically, it's nothing to worry about as long as you sit down and it resolves in about 30 to 45 minutes. You're going to have periods of it off and on. When the baby and the uterus are pushing on the diaphragm, the shortness of breath in the lungs can also make you have a really fast heart rate for a while. Again, that should subside in about 30 to 45 minutes after you notice its onset. Sit down and take a break. It's not anything to worry about. Now, if it doesn't subside and you have other things going on, you probably need to call or come in and get checked out. And then swelling is a big thing. You're going to have swelling. Every pregnant woman has swelling. They used to consider swelling as a bad sign of pregnancy, and they clumped it in with all the preeclampsia and hypertensive disorders. Now, not so much so. Now, if you have high blood pressure and you have protein in your urine and you have some swelling, then we think about that as like a syndrome. But just for people with healthy blood pressures, no protein in your urine, and doing all the things normally in pregnancy that people do, swelling is going to happen because that baby gets bigger, that baby weighs more, and that gravity pushes that baby down, which again pushes the fluid down towards the lower legs, the ankles, and the feet. If you are sitting all the time, then you're going to have more edema in your feet, legs, and ankles. It is good to actually elevate your feet and legs to about heart level a couple of times a day for 10 or 15 minutes so that circulation can be better and kind of relieve you of some of that extra fluid that's down there. Also, you treat fluid with fluid. If you have a lot of edema, soak in the tub with some Epsom salt and also drink. Make sure you're drinking that gallon of water every day because those things will help kind of shift that fluid around and get it back where it needs to be in the right spaces in the body so that you can pee it out or sweat it out. Some other things to think about that are when you're just sitting down, twirl your foot. It's good for circulation and it'll keep you from fluid just sitting in those ankles and feet. And the other thing is try to eat fewer carbs. We're from the South. We love carbs. I do. But carbs actually make your body hold on to more water than protein does. So focus on protein more. Give up some of the carbs. You'll be healthier and you'll have probably less swelling. So those are just a few of the things that are day-to-day things that happen with pregnant women. So we're going to move on, and the next thing we're going to talk about is, you want to talk about these? Sure.
So some precautions during pregnancy. We get a lot of questions about, well, can I just have one glass of wine? My friend had a glass of wine every night. Their baby turned out fine. From us, you're always going to hear no. Alcohol crosses the blood-brain barrier and can provide risk to the infant. There's a lot I could say about it, but the main thing is it can cause problems with the baby, such as mental retardation, facial malformations, growth restrictions or retardations, and liver and kidney problems. So we really, what may have been safe for your friend, we have no way of knowing if that is safe for you. So at least for me, you're always going to get a no on that. The next thing is smoking. Obviously, we have patients that enter care every day that are smoking. We're always going to encourage you to decrease or stop smoking. The reason why is because the fetal circulation can have problems with the placenta. The placenta can get hard areas on it where the blood flow does not go well. And so smoking just makes that worse. And so any amount of smoking or tobacco use that you can decrease is better for the infant. We get a lot of questions about caffeine. There's not a lot of studies on caffeine that show us how the baby is affected. Everybody sort of has their own thing on that. I'll tell you, my personal thing is you can have one soda, coffee, or tea per day. That's an 8 ounce. That's like the one this big from Starbucks, not like this big. That's the one we like. And so 1 per day. So anything that you can use decaf, the better, because we just don't know quite how it affects the baby. That being said, there are a few times we might actually tell you to use a little bit of caffeine, and that would be maybe if we were trying to question if the baby was moving, we might say have a little caffeine, or if you're someone who's subject to migraines, then we might encourage you to try a little caffeine so that we can see sort of the easy way if that affects it or makes it go away. Other things that we caution you on are illegal drug substances, which again, different states have different rules on things such as marijuana, that in Texas they are considered illegal. If we have any reason to suspect that there is this activity going on, we could drug screen you. If in the event that you had a positive screen, then when you were admitted for delivery, you will be rescreened, and if there's a positive, then social services will be involved. But the worst part about these illegal substances is that it has a huge risk for mom and baby. And I believe we've both seen this happen, that you can actually have your placenta separate from the wall, and it becomes an emergency where the baby dies and mom can also die too. So illegal drugs are really a big deal in our world. We want to see happy, healthy moms and babies. And sometimes this is a pre-decision that we have no choice in the outcome, and it's ultra sad for everyone involved. Anything you want to add to
I think that with all the things that she talked about, it's important to get a picture in your mind about what's happening when you use those. All of those things cause constriction, but our blood vessels usually work in a certain way, and our blood pressures start, we have a normal blood pressure for us, but when you use an illegal substance, or if you're smoking or a lot of caffeine, the blood vessels actually constrict and get smaller, which may not make you feel any different, but it cuts off blood supply to the baby and oxygen to the baby that helps the baby to grow optimally. So you can get a small baby for gestational age, you can get intrauterine growth retardation, or you can get a baby who actually dies because the circulation was not what the baby needed. And so the placenta helps to kind of shield the baby as much as it can, but not all substances can be shielded from the baby. They're actually going to go back and forth between mom and baby. So you can just consider whatever you're eating and drinking, your baby is eating and drinking. So would you give your baby a bottle of wine? Would you put a cigarette in your baby's mouth? Mm-hmm. Things to think about. It's harmful to them. And your baby's got no one to speak for it but you. So
the other thing to consider is over-the-counter medications. We tend to give you a list in the office of the ones that are acceptable, but also caution with that. Just because it's acceptable doesn't mean that you should do 4 times the regular dose because you think more will work better. For instance, Tylenol, if it only says 500, you only take 500. You don't take 4 times that because you think, oh, maybe it'll just make it better. In most cases, you're not going to get anything better. So be very cautious with those. Also, and that's sharing medications from someone who maybe had a baby before, or a parent because you have back pain and maybe, they have some extra stuff from when they got their tooth removed. Remember that just because you can write a prescription for it does not mean that it's safe. So if your mom had her tooth out last week and had an extra Tylenol number 3 or Norco, and suddenly you have this back pain, it's not safe or good to take that kind of medication without us knowing or without us prescribing.
And another thing to think about, herbs and essential oils and all the natural things. Yes, they're natural, and yes, you can buy them over the counter, but they're not all good for you while you're pregnant. So if you're thinking about taking a supplement or using an essential oil, especially if you're going to take it internally, you really need to ask your provider so that we can, and if we don't know, we can find out for you. So just always be cautionary of what you choose to put in your body because you don't know how it can affect your baby for the long term. And
this is for creams as well, guys. I know a lot of patients come in and they say, well, I just put Blue Start ointment on it. Well, that's a big no-no in pregnancy. So think about, any of those extra little things that you would do when you're not pregnant and sort of question, are these something that I should do while I'm pregnant?
Okay, so the next section that we'll cover is going to be exercising. Ooh,
I second that one.
Exercising and body mechanics. Okay, so when you're pregnant, when your abdomen really starts growing to accommodate the size of the baby and the growth of the baby, it makes you really front heavy. Okay, so that's why your back hurts because sometimes well, not sometimes, but all the time, it'll make you actually sway your back, which causes your back to weaken, and it will make you also more easily able to fall down. That's why you don't wear high heels. That's why you don't climb up on ladders, not because the cord will go around the neck. That's no lie, Phil. It's because you're front heavy and your center of balance is totally off. Sometimes when you wear your maternity belts like you should, it actually helps your posture be better. Your back will feel better, and it centers that point of gravity a little bit better, so you're not as likely to have an accident. So The other thing about good body mechanics is that you don't ever just bend over and pick something up. You need to squat down slowly, pick something up, and you need to only carry things about at the level of your abdomen. You shouldn't try to pick them up really high. So yes, that means that you have to be really careful picking up your other children. You really shouldn't be lifting anything over about 25 pounds. And if there are any other risk factors going on, your provider may tell you not to be lifting anything at all, and giving you some other things that you need to watch doing too. So some things to strengthen your back. You strengthen your back by exercising your back. And a lot of people will say, oh, I can't do that because my back hurts so bad it prevents me from doing it. Well, actually, that's how you reverse that. So walking every day, a good brisk walk, starting out about 10 to 15 minutes. My definition of a brisk walk, if you can talk while you're walking, you're not walking fast enough. And of course, you can't just go out there and do that, but you can work your way up to that. So walking. Swimming is actually an excellent exercise because it provides exercise for all the muscle groups in the body. And babies love water. And so when you're in the water swimming, your baby is more likely to get in a very good, efficient position for labor, okay? So other things to do are pelvic tilting. Pelvic tilting really strengthens the back. You can do pelvic tilting in a lot of different ways. You can get on your hands and knees and you arch your back like a black cat, but then you just bring it down flat. You don't sway your back. That's going to weaken it. So arch your back, bring it down flat, and do sets of like 20 or 30 of those at a time. Also, with doing pelvic tilting like that, if your baby's posterior, when you do pelvic tilting on your hands and knees like that, it's uncomfortable for the baby, plus the gravity will help to rotate the baby's back around to the front of the abdomen. So that's one of the first things that you do to correct a posterior presentation as well. So other ways to do pelvic tilting, you can lay flat, and then you can do pelvic tilting by just tilting your pelvis in. You can also do it against the wall, and you can also kind of scoot down the wall and squat against the wall and do it as well. So there's lots of different ways to do pelvic tilting. You just got to find the way that's more comfortable for you and the one that you feel like is helping you the most. When you're pregnant, you should not do any abdominal work. Don't do any exercises like crunches, sit-ups, because you've got this growing uterus behind those abdominal muscles. When you're trying to strengthen from the front and you've got a counter pressure from the inside, it actually weakens those abdominal muscles. And you really need to keep them strong so that you can use those really well to push. Other things that you can do, tailor sitting, sit Indian style. It really gets those muscles in your thighs really strengthened so that you can use them more efficiently while you're in labor. There's all kinds of other exercises that you can do. Just remember, don't exercise the abdomen and don't lift more than 25 pounds. I know a lot of people are still doing weightlifting and things, running, bicycling, horseback riding. If you have been doing those things prior to pregnancy and your body's already conditioned to do well with them, you can keep doing them. If you're not doing those before, don't start something new, because it can be harmful to you.
Which means like no starting boot camps or restrictive diets or doing workouts where you get a burn. If you're getting a burn in your joints, then you're changing the circulation of blood flow, which is ultimately not good for the pregnancy. But let me also say, I've had some patients come in doing some wild things. Like I had someone who was doing hurdles while she was pregnant because she did hurdles at the college. That was her thing. And she said she had to keep doing it to keep her scholarship. No wonder she got hurt. I had someone rollerblade, and then I also had someone get hurt riding on the back of a boat on an inner tube while they're pregnant. So guys, please use common sense. If you're pregnant, you don't want to do anything that can cause trauma to the abdomen.
And I know when you're pregnant, waking up in the morning is a hurdle. That's the one hurdle you got to do. Sorry, I was there. Oh, okay. So we have some other things to talk about as far as food. Let's talk about food choices. First of all, we already talked about the fact that carbs actually make your body retain more fluid. So does just sugar. But on a day-to-day basis, you really should focus more on protein. You need 60 to 80 grams of protein a day. And the reason why you need all that is because your body is constantly building this baby. It's a big, important job. And so protein is what they call a building block. So you need lots of protein. Also, protein stabilizes your blood sugar. When you are pregnant, your placenta produces 4 different hormones that make every pregnant woman insulin resistant or sort of pre-diabetic. So if you aren't eating the right things, your blood sugar is going to be crazy all the time and you're going to feel terrible. I have people who come in all the time. I'm sure Dion does too. I feel like I'm going to pass out. I have a headache and I have my vision isn't good and I feel clammy. Well, what's happened is you either didn't eat or you didn't choose wisely when you ate and your blood sugar went up really high and then it dropped really fast. It's not a blood pressure thing. Most people think it's blood pressure. It's not a blood pressure thing. It's blood sugar. So you have to choose good things to eat, mainly more protein than carbs. And that protein will stabilize your blood sugar all day long so you don't have those big, huge ups and downs. Mm-hmm. So some examples of protein are meat. And meat actually is better for iron and iron absorption than plant-based irons, okay? So make sure that you choose, if you're anemic, you choose more meat things. What's another thing?
Cheese.
Yogurt. Bacon.
My favorite.
Some bacon.
Anything bacon.
Also nuts. Nuts are a really good way to get protein. It doesn't matter which kind. So beans are a good protein. A lot of people think peas are protein, but they're really not. They're not a protein like we need. So some good choices for to go with your meat. You also need to do fruits and vegetables every single day. And whole grains. Whole grains are good. I'm going to tell you a little thing about white bread. What I learned in nursing school. The whiter the bread, the quicker you're dead. Don't eat white bread, okay? It's only good to use to test plumbing. You shouldn't be eating white bread.
Are you testing plumbing?
Use it to plug a pipe to see if there's a leak anywhere. Anyway, so you don't eat white bread. It's not for you to eat. Feed it to the ducks or use it to test your plumbing, but don't eat white bread, especially while you're pregnant. Eat whole grain breads. And choosing a whole grain bread is kind of tricky too, because you go and you see whole grain, you see all these breads, they're still processed. If you can't see the actual grain in the bread, don't eat it. It's still processed bread, okay? So whole grains, oatmeal, you can eat like whole grain cereals, things like that. Those are all okay. Typically when you're pregnant, I tell people don't eat any kind of cereals or juices or milk for breakfast. Those things set your blood sugar up for failure all day long.
But let's be real. That's like every pregnant person tells me that's all they eat. Cereal.
Don't do it.
And Cheetos.
Don't do it. Don't do it. You want to feel good and you want your baby to feel good and you want your baby to grow well. If your blood sugar is going up and down all the time, your baby does not have a consistent growth pattern. And so you can end up with a really big baby that you can't deliver vaginally, and let me tell you about big babies. They're cute, but they're not big doesn't make them healthy. Sometimes our most unhealthy babies in the NICU are the ones that are really, really big because their blood sugar is so unstable when they're born. So try to start the day with protein. And I know milk's got protein in it, but milk also has a sugar. Milk sugar is not very good for you. We don't have to have as much milk as what they've always led us to believe. You can do the research. I don't drink milk at all.
Me either. It's her fault.
I did breastfeed her, but just saying.
Didn't work.
Yes, it did. Anyway, so fruits, vegetables, meats, lots of meats, whole grains, lots of water, a gallon of water a day. And I know a gallon of water is really, really hard for some people. It's hard for me. But if you start off by drinking just a coffee cup, 8 ounces, not a great big mug, an 8-ounce coffee cup, and just chugging it every hour. And then once you accomplish that, start doing it every 30 minutes. Your body will get used to having that fluid, and your body will ask you for it. You'll be thirsty all the time. And it's really important because of water. Number one, it's God's drink. Number two, it helps you filter. It helps your kidneys work efficiently so you can filter everything. Your liver will filter better. You don't have as much swelling, okay? So keep that in mind. Other drinks are fine, but don't drink them till you've had your gallon of water. So those are some things about.
I want to say that I know I have a lot of patients come in who maybe work weird schedules or they don't get true lunches. And in that case, you really need to prepare. This is the pot calling the kettle black because I'm the worst at that. But a lot of times patients come in and they're telling me how awful they feel. And then I do a diet recall and they're telling me, well, I haven't eaten since yesterday because I had to work. Well, there's a few things you can get over the counter at the grocery store that are fast. And I think they're called like P2. They're by the Lunchables. I'm not saying get Lunchables. I'm saying look above the Lunchables in the little packs. And they'll often have a protein pack. And it'll have a meat, a nut, and a cheese. So if you're struggling, then you might grab a few of those because in most cases they're small enough that you can actually fit it in your pocket and you can snack, one bite here and there and get it all in so that you don't feel so awful. And then the other thing I always tell my patients is if you wouldn't feed your newborn baby McDonald's, why would you feed it McDonald's when you're pregnant? It's going in this essentially the same way. So if you think about it like that, maybe you can make better choices about what you're putting into your body and feeding your baby directly.
They also have little packages of peanut butter, almond butter, cashew butter now that are really good snacks for you. Just think ahead, be prepared, and don't go long periods of time. We actually counsel our patients to eat every 2 to 3 hours while you're pregnant instead of 3 big meals. First of all, your stomach gets really, really flat when you're pregnant because your baby's growing and pushing it. So you can't hold a whole lot. So you want to eat every 2 to 3 hours small amounts of food. And it's really important before you go to bed to have a really good protein snack. And they'll stabilize your blood sugar all night long and you'll wake up feeling a lot better. A good example of a protein snack at night is actually a protein shake. The Premier Protein, they have 30 grams of protein in them. And the little secret from somebody who knows, you can actually freeze them in little Sterlite containers and eat it like ice cream. There you go. Anyway, that's a really good thing to kind of keep your blood sugar really, really stable. If you don't do that and you wake up in the middle of the night and you go to the bathroom like 100 times, go grab a little block of cheese or go grab a little piece of turkey or something like that. Get something that's high in protein if you haven't had your bedtime snack. And then that keeps you going through the night too. Those are things that'll really, really, you'll start your day out a lot better. You'll feel so much better if you do that. So just to recap, a gallon of water, take your vitamins every day. Vitamins are really, really important because none of us eat perfectly no matter what, and a vitamin is there to kind of fill in the gaps for us. And if you feel like your vitamin is causing you to be constipated, which is very, very common, you can actually get a vitamin, a prenatal vitamin, either by prescription or even over the counter that's got a stool softener already in it. So a gallon of water, taking your vitamins, daily exercise, choose more from the protein group of food than from the carbs, and eat every 2 to 3 hours, and you'll do really well. You'll feel better and your baby will grow well. So there's one last topic that we have for today, and she's really good with this, and that is called preparing siblings.
Hey, who's good at that?
You are.
That's not fair. You're the one who has my kids wrapped around your finger.
Anyway, so you find out you're pregnant and you've got other children. So what do? How do you tell them? And how do you get them ready for a new baby in your house?
So I mean, there's a lot of ways to do this. Different ages obviously learn in different ways. I will say one of the funnest things for us is, well, pre-COVID, I mean, starting to open up a little bit, is to actually bring the siblings with you, or at least I say that. I let them be a part of the visit. I let them help me get the heartbeat. I let them measure. I mean, I promise suckers every time if you can handle that. But is to involve them. They may not completely know or understand, but when they hear that heartbeat and when you show them and then you show them the pictures and they begin to understand things around the house that you can do, and start to show them the baby's items and where the baby's going to sleep, and talk to them about, that you're going to be holding the baby, and you want to hold the baby when the baby's out, different things like that, just to incorporate them into what's going on in the environment. Sometimes you can't foresee how the kiddo is going to respond once the baby's here, but them having the best understanding before baby comes will help them to prepare before. We're hoping at some point, once all of the COVID restrictions are gone, to actually have what's called a sibling class, so that siblings can come in and learn about changing diapers and fun things like that, and see the hospital where their baby's going to be born. And so you can look for that in the future. We're excited about hopefully getting to do that. You have anything to add?
Yeah, one of the things that one of my patients told me that she did for her, both her little girl and her little boy, while they were awaiting their third baby, is that she packed them each a little bag. And in the bag were things that they would be able to specifically use with the baby themselves. They were
Great
things
idea.
that they were able to pull out anytime they wanted to and use that would be safe, and something that would be fun for them, and something that would actually be really helpful to her. And so I thought that was a really good idea, actually. And her kids did really good with that, and they carried those things around. And then she bought them both babies with the little front carriers so that they could practice holding their baby, and she taught them how to treat the baby with those dolls. Anyway, there's a lot of things to do, but I think the most important thing to do with siblings is to communicate with them and make them feel a part from the very beginning, so that because you don't know how they're going to react. Some of them are jealous, some of them are mad. All of a sudden they're not the baby anymore, and and that attention is kind of drawn away from them while everybody's getting in the mode of having a new baby in their house. But it's really important to make sure that any way that you can, that they know that they're included and they're still part, and they're not going away because you have a new baby. And once the baby gets there, it's really important to make sure that you establish one-on-one time with them, so that they don't feel like the baby's always getting time.
And while you're pregnant, you might have to sort of teach your current children how to interact with you a little more. And I don't mean like in a bad way. I mean like suddenly you have this abdomen that they're not used to, and so they can't run and jump on you and hit you and kick you in the same way. So by starting early with, mommy's got a baby in her tummy, and we have to be really gentle and careful. You can climb up beside me, and sort of teach them about it, and then let them be involved and feel baby kick and know that baby is there once you get to that stage.
Okay, so really we've covered all of our topics that we wanted to cover today. Does anybody have any questions that they want to ask? Next week, when we're back on Tuesday, we're going to be talking about labor. What does labor look like? Normals, abnormals, what are signs of labor? What are the different stages of labor? We'll talk about labor support. We'll talk about VBAC a little bit, and labor tools. And then what is an emergency birth? What are reasons why we might have emergencies during labor, and how do we handle those? So, and how to prepare yourself to get ready to come to the hospital. So that's what we'll be covering next week. If you think of any questions that you want to ask, you actually can feel free to call us in our clinic. We will call you back. Again, I'm Selena. This is Dion. Our other midwife, Jacqueline, is going to be back with us next week. And the clinic's number is 903-315-5733. We'll be glad to answer your questions for you. Natasha is also available at the hospital. You could call and leave a message for her, and she'll be glad to call you back too.
315-2075.
So 315-2075. 877-575 is how you get Natasha.
And then one other thing, maybe I'm not supposed to mention it, but we do have a Facebook CHRISTUS Trinity Clinic Midwifery group. Not only do we brag about our babies on there, because of course we deliver the cutest ones in Longview, but we do have helpful teaching items sort of for all things well woman and maternity. So you're welcome to join our group and have a lifeline that way as well.
Like we make announcements on there, like we had a link last night so that you could go to the classes today. We put all kinds of things out there that we feel like are important for you as you go through your journey of pregnancy and even well woman care afterwards and raising your babies. We like to put pictures of our babies that we've delivered, and we like to also recognize people in the hospital and in our clinics who are very, very instrumental in making sure that our birth outcomes are good here, because it takes a team. It's not just me, not just her. It's all the other people that are part of your birth team from the very second that you step into the door in our clinic until the time that you have your baby and you walk out the door when you're finished with your care with us. So go get on our Facebook and then just touch base with us if there's anything that you need. We'll be glad to help you. And if you are out there and you're looking for a place to go for prenatal care or for a well woman visit or any other kind of visit, feel free to call us. We take new patients. Many times we can get you in the same day if you have something going on that's important. And you also have to know that as a faith-based organization, we want to help you holistically. That is, mentally, spiritually, physically, emotionally. We're here for all of that for you. Anyway, we've had fun talking to you. I don't see any questions up there, but if you think of some later on, let us know. And we'll see you next week, 4:30 on Tuesday. Bye.
Bye.